Hi, this lecture is on bloodborne pathogen standards set by OSHA. So as you know, OSHA stands for Occupational Safety and Health Administration, and they regulate and pass laws to protect employees. So if you don't do the standards by OSHA, you can get in trouble. Your employees can get in trouble with. Their focus is only on employees. Now these standards are set by the CDC, which is the Center for Disease Control. The Center for Disease Control, they do all the research, they gather all the information, then they make their recommendations, but they don't regulate. The FDA is your Food and Drug Administration, and the EPA is your environmental. Examples of bloodborne pathogens, you know this because you've already had lectures on this, are your hepatitis and your HIV. And then your OPIM, always remember those initials, other potentially infectious material, such as saliva. You brush your teeth, you floss, there's a little bit of blood in there. That brings it into your bloodborne pathogens lane. So, now every office is going to take all these recommendations, take all these standards from OSHA, and they have to set up their practice. And these are your exposure control plan, your engineering and work practice controls using PPE, your vaccinations, your post-exposure follow-up, labeling and training, and record keeping. And we're going to talk about these through this lecture. So standard precautions used to be called universal precautions, and it means that every person you work on, you're going to treat them as if they have every kind of disease. You're not just looking and judging. I think this one might, or this, I always tell this story. We had a 6 or 7 year old adorable little girl, worked on her several times, and then we found out she has HIV. Then unfortunately her mother had it, and so this girl got it through delivery, through her mother. And back at that time they didn't test the mothers routinely. And then the mother got pregnant with a second child, and then they did test her, and then they found out the mother had HIV, and so they went back and they tested the firstborn, and unfortunately she did too. So you just never know. Engineering controls. So sharps containers, they're going to be readily accessible. You need to have them in the operatories so that you're not walking through the hallway with contaminated needles. They're puncture resistant, they're leak proof, they're labeled, biohazard. You're able to close them, and you're going to replace as soon as full. We had a dental assistant who was busy, probably not thinking, should have replaced this, was too full. She stuck her finger into the container and pushed down the needles. Did she stick herself? Yes. Do we know what needles she stuck herself with or who the patient was? No. Is that highly risky? Yes. Yes. Don't ever do that. She turned out that luckily she was okay, but that is highly dangerous. Don't ever do that. Other engineering controls are like your eye wash station, ultrasonic cleaner, and then the needle recapping device. Here's a picture of a metal one. I strongly recommend this when you are employed and you're out there. There's plastic ones. If your office has plastic ones, order the metal one. Plastic ones tend to tip over. Sometimes they stick to the surface, but these you can throw in the sterilizer, and they're weighted, and they're just more secure. So it's the best one out there today. Others are hand washing, and then there's a technique called one-handed scoop. I do not recommend this. I recommend that you use a recapping device. The reason for the one-handed scoop is that you're chasing the needle cap around with your one hand, and the temptation to just take out that other hand and push that needle cap on is so high, and then you're opening yourself up to accidents. So yes, it's out there. Yes, it's a standard that they say you can use. I'm telling you, please don't do it. Use a recapping device. Of course, there's no eating, drinking, or applying lipstick or chapstick in the clinical area. And then to minimize any kind of splatter. So dentistry is a high-risk field, and the reason for it mostly is because the doctor's going in there with a high-speed drill that is shooting water and air, and it's touching the tooth and the saliva and everything else in the blood, and now it's flying through the air all around everybody. And so the best thing to do is the dental assistant with the HVE. You are the greatest barrier there, that you're going to use that to suck up all that stuff so that you're minimizing any kind of risk of this splatter going everywhere. And then using dental dams. So proper disposal of waste, like bloody gauze or teeth or extracted teeth, tissue or extracted teeth, it's going to go in your biohazard. And then things you have to be decontaminated before shipping. So if you have ham pieces that need to be repaired, you're going to sterilize them before they go out. If you have impressions that you've taken, you can't sterilize them before they ship out, so you're going to disinfect them, but then you have to throw on a label here so that the next, the lab knows that this has not been sterilized. It's been disinfected, but, and then, of course, using PPE. Laundry. Employers are responsible, so they can either have a site, washer and dryer on site. They can use a professional service, or many of them do disposable gowns. But if they have washer and dryer on site and the employees are doing the laundry, you have to use PPE. You have to be precautious about this. There's also, like, for dental assistants here, for students. OSHA does not cover students, so you're not an employee, so you have to wash your own uniforms. And there's certain offices that have only a few employees, so they also can have their employees watch themselves. And the standards for it is to take your lab coat, turn it inside out, put it in a plastic bag, label it as you travel home with it, wash it separately in hot water. Do not wash it with your family wash. Everybody has everything. Post-exposure management. So, God forbid you have a needle stick. The first thing you're going to do is you're going to wash it, and then you're going to put on apply some kind of antiseptic such as hydrogen peroxide, and you're going to report it. You do not want to squeeze it and express blood. They used to say to do this years ago, but then they found out that when you squeeze it, when you release it, there's a certain amount of sucking back in. The blood comes back into the wound, and there could be bacteria that's on your finger or on the surface where you got punctured, and that will bring the bacteria back into the body. So that's why they say do not express blood. And then you want to evaluate it. So how deep was it? Was it just on the, didn't really cut into the skin at all, or it was a needle and went right into it. So how deep did it go? What was the object? Well, it went really deep, but it was a brand new needle, never used. You're good. You're good. No, it was a needle of a patient. You're not good. So what's the source? Who was the patient? If the patient was your own child and you're positive what your own child may or may not have, then you're good. If it's a regular patient, you don't know. So you have to have that patient tested. So then you'll go to your medical center. They will do a baseline blood test. This will say, this is what you already have, because we don't know if you already have HIV or hepatitis or whatever. This is going to give us a baseline of where you are. It's not a baseline of this is what you got within the last hour. So then they're going to do some consulting with you, and then if they felt it, you're going to start taking the medication. This medication is best if taken within the first 2 hours. So the more that this bacteria is going in your body, this virus is going in your body, the more it's multiplying. you know, so the quicker you can get it. So this 2-hour window is what we really want to strive for. Yes, it still can be taken after that. If it passes 2 hours, can I still take it? Yes, yes, but just take it as soon as possible. And then you're going to fill out a report. What's the route of exposure? What's the circumstances of the exposure? What's the source? So you're going to ask the patient too. So if you start the medication, then the best thing to do is to ask the patient to be tested. Then if the patient comes back and that they're fine, the negative, you can just stop the medicine. You know, this medicine will make you sick, very, very sick, you know. So it's not an easy decision to make. You're going to talk about the date and time of exposure, what was the first aid method used, and what are any treatment that might have to come from it. All Sharps injury must be recorded in a Sharps injury log, and then it's used to help employers and staff determine a situation where sharp injury might occur. So if your office is constantly getting needle sticks, you need to look at that and say, what are we doing? You know, we haven't trained. There's not enough training going on. There's not, you know. So we want to go for a no injury system. Record keeping, medical records kept on everybody. So their vaccination status and the dates, any post-exposure documentation. These must be kept separate and confidential, and you're going to maintain for 30 years after employment ends. So, oh, we don't work with them anymore, we can lose that. No, we have to keep this because you never know what's going to show up. But training records only have to be kept for 3 years. Thank you so much. Be safe out there.